BIRTHFIT. This week's question is, and it was submitted yesterday, and I'm reading it right here. My wife has been told by a GP to stop training when she gets pregnant. Do you have any data that I can share with her to disprove this? Okay, first of all, we are not giving you any medical advice. We recommend that you're under the care of a skilled midwife or an OB-GYN in your area. Hopefully your practitioner that you've chosen for a pregnancy or for a future pregnancy is connected to either your general practitioner or your acupuncturist, or people are communicating on your health team. So I get a variation of this question a lot, and there's a ton of information out there. And in general, the answer I always give for this question is go buy this book and read this, or put it on your doctor's desk. So I don't know exactly what's going on with this guy's wife or anybody else, and I cannot make recommendations based on not knowing any of that stuff or them coming in for an exam. But get this book, Exercising Through Your Pregnancy. Trust me. If you want another book that supports movement, Active Birth. This is not really exercise based, but it talks about how being active and being in an upright position and using certain positions like the squat or a lunge or all fours can actually help with certain parts and phases of labor.
So a few of those resources would be the exercise and pregnancy recommendations presented by the ACOG, as well as a study published by the NSCA entitled Resistance Training During Pregnancy, Safe and Effective Program Design. And the ACSM also has a lot of really great exercise and pregnancy resources that are all science-based and research-based. So the number one thing is to just be an advocate for yourself.
You're pregnant. Rather than give you some research, which I could do, I would actually ask your provider to give you some research as to why that is his or her stance. And not to get into a defensive stance about it, but simply because they're probably making that decision to be more cautious and conservative, but they don't necessarily have a reason for giving you that stance. And if you have them do the research, yeah, I'm talking. But if you have the practitioner look into why they have that stance, then they're going to find out that there is actually a lot of information out there supporting the idea that you should be exercising through your pregnancy. One of the best resources that's out there is Dr. James Clapp, and the book is Exercising Through Your Pregnancy. And I would just ask your practitioner why their stance is such, and you can go and do your own research, but I would also ask that they do some as well. Do you have anything else to add, Eldon?
I didn't know.
I don't know. Okay. Well, I think that exercising through your pregnancy is a great idea.
But I don't know.
I don't know. It's a good idea to do research, though, isn't it, bud?
I don't know.
All right. Have fun.
This is obviously going to be case to case, and if there's special circumstances that prevent you from doing heavy lifting, then I would say yes. However, in general, keeping exercising and active through your pregnancy is actually going to benefit you more than harm you. That being said, sticking with the level of exercise that you were doing beforehand, and definitely listening to your body. I would encourage any woman that is expecting to read the book Exercise Through Your Pregnancy by Dr. Clapp. It has a lot of research around the actual benefits of all types of exercise, but especially weightlifting during pregnancy. And like I said, just really listen to your body during this time. If there's anything that causes you pain, then that would be a time when I would recommend that you avoid that exercise. But in general, being active is going to help you train for the biggest athletic event of your life. Thanks, and have a great day.
Florida. So I'd like to take a moment and introduce you to Jimmy. This is Dr. James Clapp and his body of work around exercising during your pregnancy, and I have a little cameo over here. This book is chock full of data that is going to caress your left brain all day long. It's going to talk about the stimulus and actually what's happening when you exercise during pregnancy, the effects on placental growth, on fetal growth, the maternal benefits, the benefits for baby. It's phenomenal. I highly encourage you to look at this book and just absorb all the data it has to offer. Second, I would like to address what I call the 15-pound rule, which is implemented by nurses and OBGYNs across the United States. And that's if you're pregnant, you should not be lifting more than 15 pounds. So this rule comes from a lowest common denominator phenomenon, right? So that rule applies to the woman who has never worked out a day in her life and may have some health complications. She probably doesn't know how to move correctly. She probably has never been taught how to brace and how, all of the things that, you have learned through your yoga or through your CrossFit or other functional movement type classes. You are not the lowest common denominator. So talk to your doctor, let them know about your lifestyle and your habits, and bring the conversation to the personal level instead of this lowest common denominator level. And you might find that they have more support for you than they originally thought. So I hope this helps. Happy reading.